We mentioned earlier about some of the problems with sign-ups for Obamacare, but while that is happening, there is a surge apparently in Medicaid sign-ups. Front page story in today's New York Times. The law's expanded Medicaid coverage brings a surge in sign-ups. Let's talk about it with Senator Rob Portman. He's a Republican from Ohio and knows a thing or two about how to pay for things, former director of the Office of Management and Budget, and now sitting on the Senate Finance Committee. Just overall, taking a look at Obamacare, as we stand right now, 3+ months into its rollout, what do you think of the program?
Well, it's not working very well. I just got a call from a constituent in Ohio, a guy named Chris, who said he tried to sign up. He thought he was signing up for private health care. He ended up incorrectly going to Medicaid, and then there was a glitch in the system, and now he can't sign up at all. And they say there are tens of thousands of Ohioans who are similarly situated, kind of in limbo. So obviously the implementation is not working. Secondly, the cost, John. We talked about this earlier, but the fact is not as many young people are signing up as was expected. It's about 25% of the folks who have signed up versus the 40% goal. That means that the premiums are far higher than expected. In fact, in many states, those premiums are skyrocketing. So it's not what, the administration had promised, certainly. I also think it's interesting that the Congressional Budget Office now tells us that 10 years after this has been in place, still 30 million Americans will be uninsured. So despite the sign-up in Medicaid as you're talking about, and by the way, twice as many people have signed up for Medicaid as have signed up for private insurance, so it's been primarily a Medicaid sign-up so far. And as you know, more than 10 times as many people have had their insurance canceled as compared to those who have been able to obtain private insurance. So I don't think it's working too well.
Right. Pulling a line out of that New York Times front page story that I mentioned earlier, enrollment in private insurance plans has been sluggish.
Sluggish.
I guess euphemistically you might say sluggish is an okay word.
Particularly among young people, which again, the young, the healthier, the so-called invincibles were supposed to enroll and therefore get the rates down for everybody else. And that hasn't happened.
It goes on to say, but sign-ups for Medicaid, the federal insurance program for the poor, have surged in many states. Now, we want people to be healthy. Is that a good thing that they're signing up in droves for Medicaid, but not necessarily for the private insurance offered under Obamacare?
Well, Medicaid has its problems, as you know. It's not sustainable in its current form, meaning that the costs are increasing to the point where it can't be paid for. That's why some states, as you know, have chosen not to expand Medicaid. So this is happening in some states, but not in others, because others have chosen not to expand Medicaid. The government at the federal level has agreed to step in for the first couple of years and pay for it all. But the question is what's going to happen down the road. States like mine and Ohio look at Medicaid as one, our biggest cost, and second, our biggest increasing cost. So there's concern about who's going to pay for it down the road. And look, we have a $17 trillion budget deficit, as you referenced earlier, and we've got some big problems at the federal level in dealing with this unprecedented level of debt. So that's one of my concerns about this. We need to reform the Medicaid program, give more flexibility to the states, and help it to work better to cover those who really do need coverage.
Speaking of paying for things, you're one of those senators who voted in the early going to get the ball rolling on extension of unemployment insurance. If it was paid for, you came up with a plan to pay for it. Where does that stand?
Yeah. We'll see. That's kind of in limbo, too. In the United States Senate, we don't do very much these days, and in this case, we haven't been able to move forward on a bipartisan plan, but I think we should, and I think we can. I know we have the votes to do it. And it would basically be saying, yes, you have 26 weeks of unemployment that the states give. There could be emergency unemployment on top of that, but it should be paid for rather than taking us further into debt, which actually hurts the economy by increasing the debt and deficit. And second, we ought to do so with some pay-fors that actually help the program to work better. And one of the ideas that we had, as you know, was ensuring you couldn't double dip between unemployment insurance and other programs. So I'm hopeful that we can get back to that, John, next week and come up with a bipartisan solution that enables us to pay for this rather than simply sticking the next generation again with the tab.
We are a week or so away from the President's State of the Union address. He's going to be talking about his agenda. I'm sure he'll lay out all kinds of programs. Where do you think his agenda stands right now?
Well, we'll see. I'm hopeful the President will talk about at least two things in the State of the Union. One is economic growth. The jobs numbers from the week before last are incredibly disappointing. We looked at, unfortunately, a situation where we weren't creating many jobs, about 74,000, and yet 347,000 people left the workplace, left the workforce. So we've got to do something about this. We also have record numbers of people who are long-term unemployed, which is one reason the unemployment insurance issue ought to be resolved by helping to reform that program so that there are things like skills training as part of it. So we've got big problems. The President better talk about economic growth or he will have in his last few years here of his administration continued sluggish growth that we've seen so far. And I think one is tax reform, one is regulatory relief, certainly one is getting the costs of health care down, which hurts the economy when costs are so high. And second, I hope he will talk about the need to deal with this debt and deficit. It's real. It's an impending crisis if we don't deal with it. We have record levels of debt. It's something that the president talked about early in his first term. Hopefully we can get back to that and make a little progress.
Senator Rob Portman, Republican from Ohio. It's good to have you on.
Thanks for having me, John.
Talk
Good to
about
see
some
you.
of this stuff all day. Thank you.
Yeah, take care.